I grew up in East Tennessee and went to the University of Tennessee for my undergraduate degree and then went to UT Memphis for my medical degree. After my internship in the Navy, I went to the Medical College of Virginia in Richmond for my general surgery training, and then I returned to Tennessee for military service and then my vascular fellowship at the university. I came to Columbia in 1988. There has been a tremendous transition in surgical technique in my brief career. And hardly anything I do now is the way I was trained to do it many years ago, which is, I think, what makes surgical careers so interesting is constant learning. I can't be distracted by holding a computer or a tablet. I have to deal with them, converse with them and their family. I try to treat them the way I'd want to be treated or somebody in my family to be treated. I take my time. Sometimes my staff says I take a little too much time to get to know them and know what their problems are. I feel like I'm hardwired to be a surgeon. My father was a surgeon. I've got other surgeon relatives in my family. I kind of hold myself to a standard that I think he would expect of me. I'm happily married to Peggy for almost 40 years. We have 3 daughters. Our middle daughter just got married, so we're entering a new phase of parenthood. The endovascular techniques basically are done with minimally invasive technique, usually small puncture wounds. And even now, it's hard to fathom that we do aneurysms through incisions that are 1/4 of an inch long. So you've taken procedures that used to require hospitalizations of 3 to 10 days to perhaps an overnight observation. It does require a lot of imaging and a lot of expertise with these newer techniques, newer skills, but the patients have done wonderful, and we hardly, if ever, have any regrets with the procedures that we've done.
Audio Jungle.